Culture can have a significant impact on how diabetes is understood as a condition and how it is perceived by communities. Many myths and misconceptions also have their roots in culture and cultural understanding of the condition. And culture impacts all of us and impacts our lifestyles, how we eat, how we live, who makes the decisions on health issues in our households. So it can have a significant impact on how diabetes is managed and understood and supported. Culture can also stigmatize the condition, and people can feel as if they cannot speak out about the condition, of fear of being left out or being treated differently or being blamed for the condition. So therefore it is extremely important for the right information, the right health information to go out to communities. Diabetes Scotland is part of Diabetes UK, the leading charity that cares for, connects with and campaigns on behalf of all people living with diabetes. We provide information, help and peer support to help people manage their condition on a day-to-day basis. Diabetes UK is also one of the largest funders of diabetes research in the UK. Diabetes can be quite daunting, whether you have been newly diagnosed or have been living with it for a long time, or whether you just know somebody who has diabetes. And also, diabetes is for life. So it is very important that the people around you are able to help and support you during the highs and lows of living with diabetes. Peer support can be extremely effective, as we have found out. Someone to talk to, just knowing that you're not alone with the condition and that there are so many others living with diabetes and managing the condition well. The community support can also go a very long way in reducing the stigma that is attached to diabetes. The symptoms of type 2 diabetes are not always very clear-cut. Some people can live up to 10 years undiagnosed with type 2 diabetes because sometimes the visible signs appear only once diabetes-related complications have set in. There are, however, some signs that you can look out for type 2 diabetes. One is if you're feeling thirsty a lot, if you're going to the toilet a lot, especially at night, if you're feeling tired, if you're losing weight without trying to, if you've got blurred vision, and if you have a cut that is not healing quickly. Those are some signs that you can look out for. There are some factors that can increase your risk of developing type 2 diabetes. If you are over the age of 40, if you are overweight, if you have a history of diabetes in your family, if you're of minority ethnic background, your risk could be higher. In some ethnic minority backgrounds, from the age of 25 onwards, you could be at risk of developing type 2 diabetes. If you are concerned about your type 2 diabetes, a good place to go and find out your risk score in a confidential manner would be our online risk assessment. You can access this at www.diabetes.org.uk. We've also got a roadshow bus that travels around Scotland, and that's a great place to find out your risk score and have a chat with one of our volunteers as well. Fast forwarding a year from now, I still see BME communities as a priority group for Diabetes Scotland. The organisation will continue to provide information, help and support to this community by way of their care line, which has a translated service, all of the resource material that we have online in translated languages as well. We have our roadshow team that goes, as mentioned before, all over Scotland in towns and cities, providing diabetes risk assessments as well as a wealth of information. And most importantly, just a person to talk to. Our trained risk assessors and our volunteers are fantastic. We also have a growing number of support groups in Scotland. They are volunteer-led, and they're a good place to go to because they help people and families living with diabetes if they want any peer support or any guidance. If you would like to find out about the volunteer support group in your area, please get in touch with us. Controllable.